right, so we are here with Dr. John Michel-Ruddy, and we are going to talk to him about his Quickshot entitled Laparoscopic Transcystic Common Bile Duct Exploration Improves Outcomes in Emergency General Surgery Patients with Choledocholithiasis. Thanks for joining us.
Yeah, thanks for having me.
So tell us a little bit about your hypothesis and how you came up with the idea for this study.
So, I think as most people know, patients who come in with choledocholithiasis or CBD stones, most institutions go for ERCP to remove the stone prior to getting a cholecystectomy. But at our institution, we actually developed a protocol in 2017 to select patients who would be good candidates to undergo common bile duct exploration, so we could actually remove the stone in the operating room at the same time that they underwent lap chole. And so we wanted to look back at our data and basically see what the outcomes were. And our hypothesis was that these patients would likely have a shorter hospital length of stay, mainly because they wouldn't have to go for 2 procedures. And then we wanted to see if the complications were different or the same between the 2 groups.
Awesome. So give us a brief synopsis from there. That kind of leads really well into giving us an overview.
Yeah, so we basically, the 2 groups that we looked at are patients that underwent transcystic common bile duct exploration, and then a group that underwent ERCP followed by laparoscopic cholecystectomy during the same admission. And comparing them, basically, we did find out that there was a shorter hospital length of stay, as well as shorter time between admission and going to the operating room. And there were no differences in complications. So we looked at things like pancreatitis, bleeding, bile leaks, post-op wound infections, readmissions, all things that you would expect, types of complications you would expect from these procedures. And there were no statistically significant differences between the groups.
Did you look at costs from the 2 different consulting services or anything like that?
Yeah, so we didn't specifically look at costs at our hospital, but I think, there have been a number of studies that have looked at costs between these 2 approaches, and most of them have shown that there are decreased costs when you undergo a single stage procedure, which would be expected. And I think, that would probably bear out as well within our study population, but we didn't actually look at the costs.
For sure. Now, I know you talked a lot about length of stay, which is obviously really important in the single stage nature of this being theoretically better than the 2 stages, 2 services. Do you think this is applicable to, you're at a urban level 1 institution. Do you think this is applicable to other types of hospitals?
Yeah, so I think one of the biggest barriers to actually applying this is, first of all, getting the equipment. You need specialized equipment to actually be able to do it. You need a choledocoscope with a retrieval basket so you can get the stone out. And there is a pretty, steep learning curve to doing it. I think we basically have one surgeon, Dr. Kim, who has been doing all of these at our institution. But then the other surgeons are training how to do it as well. So I think that's a big barrier to implementing it at maybe smaller hospitals that don't have the equipment or the ability to get the equipment, and then someone to train and actually how to do the procedure.
Right. Do you have any follow-up studies planned, or what's next?
Not for this particular study. I think we're going to continue with our database and watch our, maybe look at the numbers down the road, especially as we get more surgeons involved and hopefully start being able to offer this procedure to more patients. I think another benefit that we didn't really talk about so much in our abstract, but is, patients are only undergoing 1 procedure. So they're only getting anesthesia 1 time. And then oftentimes, these patients who get ERCPs, they have a stent placed as well. So they have to come back to the hospital to have the stent removed at a later date. So I think there's a lot of potential benefit if we select the right patients to undergo this procedure.
Right. And what would you suggest if a smaller, maybe level 2 community hospital was interested in this? Who would you suggest that they reach out to talk about how to implement this in their institution, how to train their surgeons, how to train their scrub techs, and get their ORs on board? What would you suggest to them?
Yeah, so I think Dr. Dennis Kim, the senior author on our paper, he's really interested in this topic and has been kind of pushing for it. So he'd be a great person to contact, and I think he'd be happy to talk to anyone who is interested.
Awesome. Well, thank you so much for your time. Awesome paper.
Yeah, of course. Thanks a lot.